It's really hard for a patient to understand what's out there in the cosmetic provider world. So myself, I'm part of that world, but so is a med spa, and so are other kinds of offices that are not from plastic surgeons. And there's also doctors that you would never think would be in this business, like that aren't plastic surgeons or dermatologists or something like that. It's kind of buyer beware a little bit. So a point of education about that is, first of all, the person might be looking for surgery. Then people are also getting, of course, injectables. And everybody, I think, knows what an injectable is. It's either some type of a filler or a neuromodulator or like Botox. Then there's completely non-invasive procedures, which are only on the surface, more like a chemical peel, maybe some energy applied to the very surface of the skin. So those are all the things that people are pursuing in their effort to attain their goals of, what their concerns are, to try to fix those. So we try to sort that out for them. And I would like to educate them as to the fact that we have those services. But also in the buyer beware world, those services are provided by all of those different people that we talked about, even people that are completely away from what you would think is the scope of cosmetic services. So if somebody wants something and we don't think it's best for them, we'll back up. I always then say, well, why do you want that? And then they'll tell me why they want it. And because their friend had it, or because they think that's right, or they were online, or they were on my website, or they were somewhere and they want that. And I'll say, well, okay, but here's what I really think, after listening, these are your concerns. This is what I see as the situation. So let's look at a plan that may or may not even include what you're asking for, but at least we would get to a resolution of the problem. We like to consider ourselves a full service provider where we can have objective information. All of our people that are also service providers under me are supervised by me, trained by me, and we keep everybody up to date. Between myself and our society, which is that we are in the American Society of Aesthetic Plastic Surgeons, and that I'm a board certified plastic surgeon. So we have all this expertise to offer to all of our office staff. So we want to provide the best care that we can for our patients, and we want to do it in an objective way, and we want to do it so that they can get the result that they're really after.